Hi, everybody. Welcome to Facebook Friday. This is Kate Wakeland from Neuroendocrine Cancer Australia, and I know lots of people join in regularly to see this spot. So um, I don't need to introduce myself to you guys, but I know we've also got quite a lot of new people to the group this week. So just welcome to our private discussion group, and I'm our net nurse from Neuroendocrine Cancer Australia, and I just we've found it's been useful for me to pop in every Friday afternoon for a little bit of an update, not only about COVID-19, and thankfully, actually, that's playing less of a role in our lives in terms of at least the worry of getting very sick and lots of people getting very sick in our hospitals, being overwhelmed. But also just to really talk about something that's come across my desk this week and give us a bit of an update on what might be a topic of interest. And I've actually had quite a lot of suggestions from everybody. So thank you very much to everyone for the things that you've suggested. I'm keeping a list. And actually, one of the things that someone asked me last week, which I'll tell you about now because I'm excited, I was going to plug it at the end, but I'm too excited I have to tell you now. There was quite a few conversations about surgery and when doctors might opt to remove a tumour as opposed to leaving it there and watching and waiting and using it as a way of monitoring whether treatment's working. And I was talking to one of our surgeons, one of our upper gastric surgeons who works in from Melbourne, and Ben Thompson, and he actually said that he'd be quite happy to come in and join us at 1 o'clock on one Friday. We haven't got a date yet, but I think that's going to be fantastic. I know that we had some really positive feedback when Associate Professor Lainey Cameron came in to talk with us about exercise and neuroendocrine tumours. So I'm feeling really thrilled, actually, that we've got a surgeon, an upper gastric surgeon, who has agreed to do a very similar thing and talk to us about, I guess, the role of surgery and some of the reasons why surgery may or may not be offered or considered. So it's a watch this space. Once I've got a date, I will definitely be plugging the pants off that because I think it's going to be really exciting. And yeah, so before we go any further, I did want to provide an addendum to last week's Facebook Friday. And those of you who logged in might remember that we talked about the types of people who might be steering your bus, or the people who might be helping to direct your treatment. And ideally, of course, that's lots of different people who are all part of a multidisciplinary team who are using all of their areas of expertise to collaborate and come up with the best ideal plan for your situation. The person I didn't mention, and I realised this as soon as I turned the live button off afterwards, was our poor nuclear medicine physician colleagues who got a real rough deal because in neuroendocrine tumours, nuclear medicine imaging and nuclear medicine based treatments are really central, and these doctors often have a really high level of expertise. So I just wanted to I guess reassure you, if you've got a nuclear medicine physician who is, playing a major role and, might be in the driver's seat of your bus, that might be very, very appropriate. Um, so, Professor Rod Hicks, who's kind of like the godfather of neuroendocrine cancer treatment in Australia, he's a nuclear medicine physician. So, I can't quite believe that I missed that out, but I guess that's one of the perils of going live and really talking off the top of my head. I haven't got a pre-prepared speech, so sometimes there might be things that I get slightly wrong, and I'll always hop in and try and correct them. If you notice there's things that I might have missed or not thought of, or maybe should have said in a different way, or you've got more information about a topic, then yeah, hop in the comments, because I think one of the things about NETS is that we're all on this learning curve, the health professionals and you guys, and often you guys, you're the experts in this too. You're certainly the experts in living with this. So enough about last week and enough about sneak previews of weeks to come. Just a very brief update about coronavirus. One thing that I've been listening to the Corona Cast on ABC, and some of you, if you're interested in podcasts, then that's a really great one to listen to. It's Dr. Norman Swan, and he's got a killer Scottish accent, which I'm always a sucker for a good Scottish accent, but also he knows his stuff, and he's got a really measured way of describing things. He's a good explainer of things. He says things in ways that I understand, and often that means that other people will understand them too. So um, there's been a few conversations over the last few days, including some fairly kind of sensationalist headlines about a new strain of coronavirus and whether this might be more deadly or contagious. Really, the jury's out on that. So there's some early thinking about it, but it's unclear from what he was saying in his podcast. And I'm getting this secondhand, I'm feeding this through to you. So, it's always something that's, it's an emerging area of knowledge, but it seems. So I've just talked a bit about an addendum from last week. We've just talked a little bit about COVID-19, and I was probably blabbering on anyway, so it's probably time to move on to the next thing. So we just talked a little bit about coronavirus and how things, the new normal, who knows what normal's going to be like, but we do this all the time with cancer. So interesting times for the community to learn about some of the things that I think and I'm using us knowing that I don't have cancer, but in chatting with a lot of people with cancer, I get to hear. So Sandra's just asked, am I starting again or carrying on? Sandra, I'm trying to, oh gosh, it sounds like it might have been gone again. Okay, I'm going to try something different. Actually, no, it seems like someone might still be there, so I'm going to soldier on. This is going to look great for everyone logging in tomorrow, but you'll just know that Friday's internet was rubbish, and so this is what we have to deal with when we're in lockdown. And I just should, for the purposes of full disclosure, I've got a teenager doing a singing lesson in the lounge room. I've got probably another young adult live streaming Netflix upstairs. So I think all of our internets are suffering under the load. But anyway, I can see a few people are still in, so let's go. I wanted to talk to you a bit about when things go awry, and this has come up in the group a couple of times over the last couple of weeks. So I think we were sort of really talking a bit about it last week when we were sort of talking about, well, who's driving the bus, and sometimes the conversations that happen around things like getting a second opinion, or questioning whether the hospital that you're at are doing the best job, or if something's actually gone wrong, like there's been a mistake. Someone recently had a scan that wasn't meant for them. Actually, it was a female and it was a male only scan, so it was a real pity that actually didn't get picked up somewhere along the way. So I guess our hospitals, just like our shopping centres and just like our police stations and everywhere else, they're populated by humans, and we all make mistakes, and so I guess as well what we do about that, A, to try and prevent the mistakes happening, B, what happens when the mistake's made and how we address that and how we get that feeling okay for everyone, and C, how will we learn from that and hopefully it doesn't happen to the next person. So that's the first thing I really wanted to talk about is, well, yeah, we are all human, but also even before we get to a mistake being made, everybody's so different. So not in a dissimilar way to the fact that all neuroendocrine tumours seem to have their own personality and their little ways about them. Each individual will have their own style. And so it's interesting for me, I talk about, there's doctors whose names come up over and over again: Dr. Nick Pavlakis, Dr. David Chan, Dr. Michael, Dr. Rod Hicks, we've already talked about. For any one of those doctors, probably 90% of the patients who talk about that doctor will be really thrilled with what they're doing. They'll like them, they'll feel like their communication's working. But actually, we've pretty much for every doctor, there's a bunch of patients where they just, for whatever reason, they just don't connect. They're not on the same wavelength, and they're just not, they haven't got the vibe going. So sometimes, and I think this is hard for people in rural areas because often you don't have the same level of choice as a metropolitan person. But if you're in a hospital with a reasonable number of doctors, sometimes there's another doctor in the service who you can actually talk to. I know that not everybody has that option, but it's worth sort of checking that out and seeing. I guess if things do go awry, particularly if there feels like there's been something that hasn't been ideal or normal, or if there's been a mistake, it's really, I guess, important to think about, well, what do we do? Sometimes people will just decide to swallow that and just to, okay, well, let's move on. And if you're able to do that, and it's not been a serious thing, then I guess, that's great, because, the more we can extend grace to everybody and understanding to everyone around us, that's usually a good thing. But sometimes things go awry in a way that we would actually not want that to happen to the next person coming along. And reporting that, getting that feedback. Oh my goodness. So seriously, this has to be a record. Like, that's the maximum number of dropouts. I've switched to my phone. We'll see how we go. I think I'm going to need to make this really quick, because we don't know how long this is going to last this time. So I was talking about when things go awry, and sometimes there are times where there's been either a serious error or just something's happened where you're thinking, that shouldn't happen, and maybe we need to take some steps to work out how to help it not happen again. Sometimes it can be tempting to just talk to each other, and that's actually quite useful. Often, we need to get support from each other when difficult things happen. I can see someone's found me, so that's working. So sometimes we do need to get support from others who are living with neuroendocrine cancer, to get some support. So we get some ideas, share some sort of feedback about, well, did that sit all right for you? Is it just me, or does that seem a bit strange? But if you just tell another patient, and even if you just tell me, that's actually not going to necessarily result in any major change. It won't necessarily mean that the next person coming along doesn't have the same issue. So sometimes we do need to be really brave and find a way to pass that feedback on. And I guess the really important thing is that feedback's passed on to the right person, but also passed on in a way that's really constructive. So finding the right person. So every hospital in Australia, by law, has to have a mechanism for passing this sort of feedback on. They keep statistics. They report on this every quarter. They keep statistics. And in the hospital that I worked most recently, actually, all of the comments that patients had put in via the online feedback process, they were actually collated and graphed, so we knew how many were coming in each quarter, and we actually got to read people's comments. So it's actually really nice to pass positive feedback on too, because often that does get to staff. And so when we would get a message, I was working in a day oncology centre, if we would get a patient feedback that someone had had a really positive experience, that just made our day, because that's what any health professional is there for at the end of the day, is to make a difference to someone. So but yeah, hospitals, they legally have to have a mechanism for feedback, whether they're compliments or whether they're constructive complaints, to go through to. So if you're dealing with a hospital, it's all on their website, and it should be really very easy to find. But if you have trouble finding it, then let me know. If you do have an issue, like you feel like there's been a mistake or something's gone wrong, in writing is a really good way of providing that feedback. A phone call really relies on the person who's listening to you talk, interpreting that message, and getting a really good handle on what you're saying. And sometimes that can be really great, and sometimes that can be really muddy and challenging. So putting it in writing is a really good thing. And if you're going through a process where you're thinking, I think I'm going to need to have a conversation with someone about this afterwards, then keep some notes. Keeping it factual is really, really key. It's so crucial. It's much harder to talk about something there's a feeling. It's much easier to talk about something that's a fact. So if someone has said something to you that didn't sit right, have a think about whether it was the manner that they spoke to you in, or whether it was actually the words they used. If it's the words they used, write them down word for word. But if it was something about their manner, keep some notes about, well, what was it about that manner? See if we could be really specific. So whether it was the person didn't make eye contact, whether it was the person was keep looking at their phone, bearing in mind that all of these things are very much subject to people's personality as well. So there might be people who are great clinicians, really good at their job, but they're just not a great eye contact person. So, we try and extend some generosity there. But, sometimes we do come across people who are a bit burnt out, or they need a holiday, or they need some communication skills training, or they just need to just have a bit of gentle feedback to say, hey, that behaviour might come across as being a little bit uncaring. So keeping it really specific, trying to stick to facts. And when you're providing that feedback in writing, having your bullet points. So having this is what the facts of the situation are, and then really importantly, you need to talk about what the impact for you has been. So if it's a good thing, you can say, you know, that made that treatment go more smoothly, or it made me feel more confident about my plan. You know, it's always good to, as I said, provide that positive feedback. If it's something that's a constructive criticism, it's, you know, it might be that resulted in me having to come to hospital again or have another blood test again, or, you know, in the case where someone had a unnecessary scan, you know, that person had a bruise from the cannula, they had to pay 2 lots of parking. They did have an unnecessary dose of radiation, so that's seriously not ideal. But it's also, you know, concern about waste of resources for the hospital and that sort of thing. So talk about what the consequences of that situation have been for you. And then the hospital should respond. They should get back to you. They should be able to have a conversation with you, or ideally meet in person. And what happens from there is really between the two of you. Sometimes it's really helpful to have an apology. And hospitals, you know, they do that. Absolutely, they do that. Sometimes it can result in greater change. So sometimes these sorts of pieces of constructive criticism or complaints lead to more equipment being bought, or lead to greater staffing. So if there's been a collection of the same kinds of issues for people all in the same hospital, it gives the hospital an argument to say to government, hey, you're not giving us enough resources to deal, you know, to manage this service properly, you know, help us out here. So it can be really very powerful in terms of a resource and funding point of view as well. But really at a base level, it helps you resolve the situation with your healthcare professional, so you can get back to being in that constructive, hopefully, that constructive relationship where you're both on the same bus, pointing the same direction, you both know who's in the driver's seat, and, you know, it's pretty clear, you know, what that plan is. So that's all I'm going to say about when things go awry, except to say that the Cancer Council have got some good information about rights and responsibilities. So I'll make sure I link to that at the end of the video. I can see that only a few people have made it into this part 3 of this live feed. So my apologies about the Wakeland household internet. I might have a chat with my family about what we can do about the dropouts, but perhaps it wasn't their fault at all. Maybe I need to extend some generosity of spirit to my teenagers as well. Anyway, just a couple of things I wanted to mention before I finish up today. The first thing is there was a conversation which I'm not sure if everyone caught, which was about Spotify. And it was, I guess, knowing that a lot of people, when they're out walking, and we're all doing our Let's Walk for Nets challenges, and there's been some fantastic photos once again, but one of the conversations made me really smile, and that was that there's been a Spotify playlist for neuroendocrine cancer Australia patients. I will put a link in the comments. There's some fantastic songs. That's a real window into people, because you can actually see, I don't know if I should say this, but on Spotify you can see who has suggested the songs. So Rachel Carney, I'm on to you. I know what your musical style is. So it's really interesting, but there's some great songs in there, and I've been listening to those songs as I walk, getting my step counter up. And I guess listening to those songs made me think about you guys, and the fact that you're all walking or shuffling or sitting, if you that's all you're able to manage, but you're all living with neuroendocrine cancers. And these are some of the songs that have helped you, and I'm actually finding that a really lovely way of feeling connected with the community when I'm out walking, and it helps me bring you to mind and really hope that, you know, you're having an okay day. And I just thought that other people might find it useful to listen to that Spotify list as well. Spotify's free. You can get paid accounts like any kind of online platform, but you can just hop on for free and listen to the playlist. So I will stick a link in the bottom, and you can actually suggest new songs. So it'll be interesting to see how long this playlist gets, but I'm finding it really lovely. And the other thing that Spotify playlist has reminded me of is we've got lots of photos up on the Facebook group, but when I'm out walking or when I'm out running, I love to actually listen as well and hear the sounds, whether it's the sounds of, you might hear the sounds of traffic when you're out walking. If you're lucky enough, you might actually get some sounds of nature. And I've actually popped a couple of little tiny videos of some of the things that I've been listening to into the Facebook group. So I would encourage you, if you're posting a photo, feel free to post a little video clip of the things that you can hear if it's, I guess, helping you on your way. So just a little thing about the Spotify list and I guess listening and using all our senses to feel connected and to feel nourished. So the other thing I just want to mention is that next Friday we will be having Facebook Friday again at 1:00 p.m. and I will be really crossing every finger and every toe and I don't know, praying to whatever gods are up there that I managed to get it all in one go this time, but we'll just have to play that one by ear. But what we will be doing after Facebook Friday is having an online group chat. That will be via Zoom. And off the top of my head, I think I made it from 2:30 till 4, and that's Eastern States time. So Adelaide, Northern Territory, WA, you're a little bit different, but we made it sort of that time of the day so that those of our family who live out west will still be able to join us. And we'll be running that group once a month. It's open to anyone who is part of this online neuroendocrine cancer private discussion group. So you will notice actually there's a few new people in our group this week and they've joined the group so that they can actually watch the Facebook Friday, such as the glorious mess it has been today, but also take place in some of these online groups that we're making only available to people in this space. Zoom works well up to about sort of 10, 12 people. If we get many more than that, it gets a bit unwieldy. So if these groups are very popular, then we might need to cap numbers, but we'll cross that bridge if and when we come to it. We're not having speakers or guests at this point. It's a discussion group. It's just a chance for us all to hear each other's voices and to be on screen, and I will be at those meetings. Every alternate month we'll do a Friday afternoon, and then the other month we will do a Wednesday evening. So that, because I know that there are people who work and find it difficult to dial into something during the day, but find the evening a bit easier. So we'll be sort of sharing the love around so that everyone gets a chance to participate. So there is an event listed in the group. If you click on, interested or going to that event, you'll get the little notifications of things like the link for the Zoom room and that kind of thing. I'm just trying to think if there's anything else I was going to tell you about that. But yeah, I'll just be looking forward to hopping in and seeing where the conversation takes us. Keep your suggestions coming for Facebook Friday. As I said, in video number whatever it was back before everything crashed several times, we'll be doing... we've got a surgeon who's coming in to talk about surgery for neuroendocrine tumours. I don't have a date for that yet, but I'll put a plug up for that when we've got it. Also, I'm going to be doing one on pain relatively soon, but there's been some other requests as well, so I'm working on those. I've got a list which I'll keep having a look at, and we'll see you next Friday for the next instalment. But look, I hope you have a good weekend. I'm thinking of, there's several people who have been unwell in hospital this week. Richie, I know that you had big surgery on your arm yesterday, and there's a big group and there's lots of you out there who have had a big week. So just thinking of you and hoping that you do okay. As always, I'm around on the phone. Emails are great. Please don't send me private messages on Facebook because I won't see them and it's a mess. So yeah, phones and emails and phone is the best way. And I'm going to stop blubbering on. I hope you have a great weekend. I look forward to seeing you next week.